One of the things that we know is prior to COVID, burnout was on the rise with healthcare workers. And actually, if you look at the statistics in the US, they had the highest rate of suicide of any profession. So that's shocking because you don't really hear much about that. And the hospitals were kind of beginning to wonder about wellness, but quite honestly, hospitals, their main focus has been, their patients is patient care and making sure they have the best equipment and they're doing what they need to for patients.
Hi, everyone, and welcome to another episode of Carpe Diem Living the Podcast. I am your host, Shane Gitmed, and today we are in Chicago, and we are talking to Dr. Saloumeh, who is an amazing woman doing so many things right now in the healthcare industry. So I'm so excited to have her on the show. So welcome.
Thank you. Thank you for having me.
So do you want to tell our listeners a little bit about your background and just all the things that you're currently working on?
Sure. Yeah. So my name is Dr. Saloumeh Bozorgzadeh. I'm a clinical psychologist here in Chicago. I'm the current president of a nonprofit organization called the Sufi Psychology Association, which is a psychological organization that brings the teachings and principles of Sufism into psychology. Now, Sufism is a path of self-knowledge. It's all about understanding and recognizing and knowing who you truly are, not just like the narratives we have in our heads or the things that we're told by society in terms of what's good and bad and who we are, but that source of stability and strength that we all feel within us. And so it's about knowing yourself and knowing your potentials, your true potential and your capabilities. So the Sufi Psychology Association, for a while, we've been doing a lot of workshops and talks around the world on various things. In particular, we've been focusing on healthcare worker burnout prior to COVID. And then when COVID occurred last year, we began an initiative called Caring for Our Caregivers to help target this issue of healthcare worker burnout. One of the things that we know is prior to COVID, burnout was on the rise with healthcare workers. And actually, if you look at the statistics in the US, they had the highest rate of suicide of any profession. So that's shocking because you don't really hear much about that. And the hospitals were kind of beginning to wonder about wellness, but quite honestly, hospitals, their main focus has been, their patients is patient care and making sure they have the best equipment and they're doing what they need to for patients. And healthcare workers are notorious for putting others' needs before their own. So they also have this tendency of not necessarily, and not all of them, I'm generalizing here, but they do have a tendency of perhaps not looking out for themselves in the same way that they would others. So when COVID happened, we were very concerned because not only are healthcare workers now working overtime, but now they're worried about their own health. They're worried about the health of their family members. They are worried about if they don't even know what they're fighting necessarily, not to mention that they have become now the sole support for their patients because no one else is allowed in the hospitals. And some of them there to the very end of these patients. So there was a lot of pressure, or there still is a lot of pressure on them. So what we did is we teamed up with this other nonprofit organization called Tamarkoz app, the Tamarkoz Association. They have an app. Now Tamarkoz is it's a Sufi meditation practice. And it consists of 5 different techniques that I'm sure you've heard of, like deep breathing exercises, visualizations, there are some meditative movements. And all of these have independently been researched to show that they're very effective in decreasing stress. Tamarkoz itself as a practice has been taught at hospitals and universities across the globe. And the research that was done on some university students who were engaged in Tamarkoz was that they found that students who were doing daily or regular Tamarkoz practices, that their perceived stress decreased and their positive emotions increased even in times of increased stress. So times when other groups in the study, their stress is going up because they're hitting finals or something, this population, their stress just kept decreasing and decreasing. So we figured this is the perfect thing for our healthcare workers, and we teamed up with that organization. They were kind enough to actually give us the videos they use on their app. And we downloaded them onto tablets, disabled everything else. So it can only be used for this. There's no Wi-Fi, no sign-in, nothing is needed. You just turn it on and push play. And we were donating this to hospitals with individually wrapped disposable headsets. And so the videos range from 3 minutes to 30, depending on how much time somebody has. And so the goal is to give healthcare workers something tangible in the hospitals that they can use during stress.
That is amazing. I love that so much because for me, I'm seeing that there is more awareness going on about mental health, things that really do help, like breath work. I didn't even know about breath work until last year. And it's amazing that these studies and everything have been happening for so long, but it's just now that more and more people are applying it to their lives. And what better time than now when everyone needs, some relief from what they're doing, whether they're stuck at home with their whole family, but they're still required to work, they have to take care of them and more. And then versus people that also have to go into work afraid, because even my mom, she's been working as a lab tech for the last 20 years. And it was rough hearing how exhausted they were, how afraid they were. There was even one instance where because she draws blood and some of the blood had kind of come out. And she was like, oh my gosh, I don't know, everyone's just so afraid of something that they're not really sure what they're looking for, like you mentioned. And it's true when we're talking about healthcare workers are sometimes with their patients till the very end because they don't have the family members come in. I actually saw a Facebook post about that. It was a healthcare worker sharing their story of what it looks like inside the hospital. And they're just so emotionally exhausted of just trying to be everything for everyone. And it's like, well, where's the support for them? And we can, post about it, say we support them, but what can we actually do for them that will make a difference? So I just admire so much of what you're doing for them.
I mean, we're happy to do it. So there's a few things. I know some of my patients in private practice are healthcare workers, and they would talk about one of the nurses who I work with was talking about how this was in the beginning of the pandemic, and they gave her, an N95 mask, and they're like, okay, you have to go work with the COVID positive patient. And she was like, is this enough? And they're like, no, that's all we have. Yeah, it's enough, And she said she goes in and she's working with this patient and, her heart is just bleeding, right, for this patient, so sad for them and trying to help them. And then the physician walks in full garb, covered from head to toe. And she's like, do I have enough coverage here? What is this? And, she leaves and she's worried because she says, I don't know if I have it now. I go home. She strips in the garage, wipes the banister. She runs into the house, takes a shower, afraid to interact with anybody in the house because she's afraid that she has it. She might give it to her family. And then is so tired, she just kind of goes under the covers and just turns off the light. She doesn't want any stimulation. And what was interesting, I was going to say funny, but not really funny, but what was interesting was that one of the things she kept saying is, I don't know why I feel like X, Y, and Z, why she was coming in. And I was like, you are burning out. You don't. And so that's the thing is they don't even realize that the feelings of detachment, because usually burnout starts manifesting. It's not like when we use the word burnout and in regular day terms, it's not really that way. Burnout in terms of this clinical situation is more of, it starts with irritability. You find everyone kind of annoying. You're getting into more arguments, and then you begin to detach from patients. So you're not feeling that same level of sympathy and compassion for the patient. And then it begins to affect your sleep. It begins to make you numb, and it kind of continues this way until then it begins to affect your physical health. And then not to mention depression or anxiety that results from it. And so a lot of people who are experiencing burnout then engage in more maladaptive coping techniques like drinking or drugs or something to kind of just take the edge off, which then their problem has now multiplied. But so it's something that you don't recognize is happening. And so she's feeling blah. She's like, I'm not sad. I'm just blah. And she doesn't know what that is. And it's like, well, this is what it is it's building up into your system and you don't even recognize what's happening because it doesn't look like, oh, I'm tired. It doesn't look like that necessarily.
At some point, do you think it turns into basically an autopilot feeling? They know their schedule, they just check in, check out until a point where they're not fully there mentally?
That's a part of it, right? That's the detachment piece of it, where you're just going through the motions, quite honestly. One of the issues is that it's not To come back from that is not a quick fix. So it's not a like, let me take a pill and deal with my burnout. It takes time to kind of get back into it. And then the other part, which is the part that is the most concerning for me right now, is that a lot of places and a lot of people are like, oh, good, the vaccine's here. We're almost out of this. But the way this type of event works is that, and I'm sure you've experienced this if you've ever gone through a stressful event, is in the moment, you're pulling through. Your body and mind will pull you through. It's incredibly resilient and adaptive. It'll get you through it. But when things settle down, that's when it hits you. So that's when you actually begin to feel the effects of what you just went through for the last year. So even though a lot of people are like, great, vaccine is here, pandemic is almost over, whatever, we still have to take care of our healthcare workers that they're just now going to start feeling it. And what that means and how long that recovery process is and how they cope with it is very telling as to where we're going to be in a bit.
I know. It's so most people don't think of it that way for sure, of the aftermath of everything. And I think also because you're so busy, so occupied, of course, you can't stop and think about what's really going on with your body. And the meditation piece, I think, is so important for sure, because when you are still within yourself and everything is quiet and you can actually focus on just your breathing, that's when I feel like things come to realization. You're like, oh, wow, I'm feeling this. This is where I could use some more support. Like, I know for myself, when I do meditate, it's like certain thoughts I didn't know were there. I'm like, oh, wow, like, thank you. Like, it's coming to light. So I just think it really is important to just take a pause, check in with yourself and ask, like, how am I really doing? Like, I may be checking the boxes, getting things done, but where am I at on a scale of 1 to 10? And so the self-awareness, I just know that's like one of the biggest pieces to this is versus suppressing your emotions. I mean, one thing I used to do was a mood tracker. Like, I would track my moods. That way I can see if there's any patterns, during certain times, or if there's certain things that would trigger me, because I used to suffer from anxiety for a long time, and it manifested into really bad insomnia for so many years. And so those two combined, of course, caused irritability, low energy, so many things, but yet I was pushing myself to still be doing a lot of things. So it's just a bad combination. So I can totally see on how the long-term effects, if you aren't taking care of yourself in the present, you will certainly not pay for it, but experience it in the future.
Right, right. And I think the other challenge, so there's a few challenges with this. I think the other challenge is, healthcare workers are busy. Like you said, they're busy, right? And the concept of sitting down to meditate, or even meditation, anything really feels like work, especially when you're burned out. So this is why we have it in hospitals. Like, there are apps that provide it, like people can download.
Like
Headspace. Right, exactly, which are great apps. But the reason that we have it in the hospitals is because a lot of the training for healthcare workers on burnout is in recognizing the symptoms in your colleagues. Because like I said, you don't recognize it's happening to you until it's usually too late. But you can see it in each other. And so part of this the goal was also to look out for one another. So perhaps the charge nurse can look and say, you need a break, go take a break. And here's something, because one of the other things that we were hearing is that healthcare workers were on their breaks. They were sitting in the break rooms and they were just kind of staring into space, like just in kind of the state of shock almost.
Kind of like, what just happened? What did I just see?
Right. And just like waiting for this time to pass before they get up, but like not interacting, like there's, because they're burnt, they're tired. And so part of this is also, it's not a sense of meditation in the sense of just clear your mind, because actually in the midst of this, you don't want them to be alone with themselves, right? If you're in the middle of a crisis, like to be alone with yourself for a minute and get like all these emotions and thoughts to come your way, you will absolutely break down, which is why our system pulls us through. So these practices that we put on the tablets are ones that are more guided. So it's giving you more of a distraction almost of somewhere else to put your mind. So, focus, like it's focused breathing, like focus this and imagine this and visualize this and that. So it's not necessarily blank mind and be alone with yourself, which is important. but not in the midst of crisis, right? So it was more of something to give them a break from their minds, a break from what they're experiencing so that they can have a sense of relief and a little bit of, I guess, comfort in the midst of all of this.
Right. It's also true. What are your thoughts on aromatherapy when you tie in? Because I know, yes, it's absolutely so important to be able to, get your mind, put it in a better place. I know for myself, aromatherapy kind of helps me snap out of it too. Like I feel more relaxed. And I wonder how effective it would be if they were allowed to have, aromatherapy in the break rooms, just something, because I know with smells, like if you smell something pleasant, automatically it snaps you out of whatever's going on. So yeah, I'm just wondering what your thoughts are on that.
Yeah, I haven't studied aromatherapy, so I don't want to speak to it in that sense. What I will say is there are studies out there in terms of how it's beneficial. There was one hospital that they didn't have any wellness rooms, so we went in and created one. And with that, we did put in there some essential oils and a diffuser. I will say one of the things I do in my own treatment with people is I use scents as a way to ground into the present moment. So for example, if somebody has test anxiety, for example, and they're about to go into a test and they get wrapped up in their head and they get really nervous and they talk to themselves and kind of freak themselves out. Yes, it's a common thing. They freak themselves out. One of the things I'll have them do is I'll have them put some essential oil or perfume on their wrist. So when they're in the test and their mind is getting the best of them, to smell it and to ask themselves, what are the notes? What am I noticing here? Is it rose? Is it jasmine? What does it exactly smell like? What that actually does is it brings them, by focusing on your senses, in this case, the sense of smell, it brings them into the present moment and gets them out of the cycle of their mind, which is just going, and gives them a moment reprieve. So then they can reset and they don't get trapped in that cycle. So I use it in that way, or during like meditation classes or Tamarkoz classes, I sometimes have some form of like aromatherapy going on. But yeah, I wouldn't want to speak to it in the scientific sense since I'm not really qualified to do so.
Yeah, no worries. Yeah, I was just wondering because I'm seeing more and more people applying it in general. And I'm like, I'm just so glad because I mean, even myself in the very beginning, when I heard about essential oils, I'm like, is it that simple? Like we almost think everything is much more complicated than they are. So I was like, how could you possibly get so much relief in all of this by just a smell? But I mean, from time to time again, I've applied it for myself. I know with my mom, she would get really bad migraines, headaches while at work, but she would still have to push through. And my mom is one of the she is the most hardworking person I've ever seen in my life. And she could be in the most pain, everything, but she'll still come through for her coworkers, her patients, and she won't stop. I don't know. I'm trying to get her retired so she can just take a break. She's been doing this for so long. But what I ended up doing was giving her this peppermint oil roller. That way, like whenever she feels anything, she can just roll it on her wrists, on her temples, and it would help. It would help significantly. So her colleagues were like, what are you taking that's making you like, even though you're experiencing all of this at work? And so she ended up recommending it to her coworkers and they're like, where did this come from? So I always try to think about like who can benefit from any of these types of modalities. So it could just make their day go smoother, make it just any easier than what they're going through right now. And I think it's awesome. I just thought about it with the tablets, just being the program, not worrying about Wi-Fi, because, hospitals don't have the best signal. So
yeah. It's like in an ideal world, we would have like a whole system on there. But quite honestly, it was just panic mode. It was like, how do we get this into the hospital? Least barriers for people, for both the administration to accept it, because if you have Wi-Fi, they're concerned about something then getting onto their Wi-Fi system, some kind of virus, who knows? So it was like at least barriers. And then we don't want something for like, if the staff is stressed, we don't want them to have to log in and try to figure something out in them, just push play. That's it. You don't need anything else. But yeah, that was one of the things. And so we began this initiative in April of 2020. And by the end of the year, we were in 290 hospitals, 50 states, 4 countries. Right now, we're in over 300 hospitals still getting requests. And it's so needed. To your point about the aromatherapy, I'll say that I do think the conduit is maybe the aromatherapy, right? And that helps with this. And for some people that really works and they are open to it and accept it and it works for them. I think actual method of calming and decreasing is something that's more internal that we're doing, but we're using this as a tool to kind of maybe trigger that or remind us of that. But nothing outside of us really affects us in that way. Yeah, I mean, sure, it'll affect, maybe there might be things where it's affecting the chemicals in our brain or something. I'm not sure about aromatherapy if it goes that far, but I think what it's doing more so is it is triggering that which is inside of us to then calm us down, right? So it brings it back to us and the resources that we have within ourselves to do all of this.
Right. Oh my gosh. And I just love how fast it spread and that it was getting approved, because clearly there's a demand for it. Clearly it's working. And I'm trying to think if there's any of those here. And I'm sure there are in Northern California, because that's where I'm currently at. Because I know there's so many healthcare workers in my own family that they could really benefit from this. So I love that you're making a difference, making an impact, and just showing that even though we're going through all of this, we support them, we're here for them. And I'm excited to see, do you think this product will expand over time, or any new developments that you're kind of thinking? I don't know if you can release that information. But...
No, yeah, of course. So on our website, caringforourcaregivers.org, it's the number 4, caringforourcaregivers.org. We do have a list of all the hospitals that we're at. We update that regularly. What is expanding is we are expanding into doing, like some hospitals need more resources. So then we're creating more wellness programs and initiatives for them that kind of target specifically what they're looking for and what they need. Every hospital, one of the things I've learned through this process is really every hospital is so unique. They all have their own culture. It's different. So it's not, you can't ever have a one size fits all. You really have to speak to them and communicate and make it for each. But also, like to your point, we're focusing on healthcare workers, but it's not just healthcare workers. Everybody in the world is struggling right now. This is really a unbelievable time where everybody is struggling. And so part of the Tamarkoz Association, one of the things that they did was they started putting their videos on Instagram and Facebook, these 30-minute long sessions of Tamarkoz in 10 different languages daily, so that people can just get relief, because we saw what the research shows with it. Sufi Psychology Association last year in March, we created a online course, if you will. It's called like a course, but basically what it is every couple of days, everyone who's registered, it's free. Everyone who's registered would get a short video from a healthcare worker addressing another issue related to the pandemic. So whether it's insomnia or whether it's dealing with your anxiety, we figured that with all the negativity that's going on, it's really helpful to have these constant reminders of how to cope, and maybe some like little techniques and homework assignments to get you going, so that there's a little bit of this to help target this just incredible time.
Yeah, no, those daily check-ins really do help, because it's like equivalent to the apps that you mentioned, like Headspace, Calm, when they kind of send you a little ping like, hey, don't forget to do your breath work, or don't forget to stand up and go outside today. Just, I think those really help us kind of like snap out of like our routine or what we're currently doing, because it's so easy to get wrapped up in the busyness right now. Like everyone's so busy, whether they're at home or working outside of the home. Everyone's situation's different, but it's all because of the same reason. So like for me, for instance, I'm at home. I've always worked remotely, but I have my toddler with me who should be at preschool. So what should have been, and a lot of other parents I'm sure understand that they were expecting to have their kids in school, like on a routine, but now that's a different type of stress that we're dealing with, is how do we make sure that they don't fall behind, that they get what they need emotionally, mentally, physically, because like even something as small as parks being closed, kids couldn't go outside and get their energy out. So I'll mention this too. I'm actually teaching my son, when he's having feelings of anxiety, how to just pause, take a breath, and relax. And it really has helped him, especially in the middle of tantrums or when he's trying to communicate what he needs, but I'm not quite understanding what's going on. So I just love the universal connection of how we can all benefit from these tools. So let's just keep on spreading that awareness worldwide.
Yeah, hopefully that'd be great.
Yeah.
Yeah, I guess one other thing that I can think of that is being done. So one of the other things actually Sufi Psychology is doing for healthcare workers is once a month, it's the first Wednesday of every month, we have something called Wellness Live, where we have an hour long, it's on Instagram and Facebook, an hour long, either an interview with another healthcare worker or some topic related to healthcare professionals, giving tips and suggestions. And then last week, this is really exciting. Last week on Thursday, we did an event called Show the Love, and it was a celebration of healthcare workers is basically what it was, because we figured it's been a year. They have done so much for us. And we just wanted to give them one day where we are focusing entirely on them, celebrating them. And so we had programming for the whole day on the hour, every hour, whether it was a meditation or a journaling exercise, or a bunch of comedians came together and did a comedy relief thing, or some nutrition program where we had like a chef and a doctor come on and talk about nutrition for healthcare workers on the go and what they can do, journaling. I mean, we had just every hour something for them, just trying to keep it light and upbeat, not too much of a downer. And so that was one of the things, and a lot of the hospitals that we're in were kind enough to stream it for their healthcare workers, and just spending some time to thank them. Because I think one of the things that happened is in the beginning, there was a lot of awareness about this. If you recall last year, people were all talking about it. And then we just kind of, life got in the way and we got used to it. But now they're still going. And with the vaccine, their work is even more, because they also have to administer the vaccine and they have to deal with that. So I think just spending as much time as we can, really appreciating them and everything that they've done in whatever capacity that we can, is really great.
Right. I completely agree. And for me, especially when there was like shortages of just basic materials you would think that they would have, like masks, gloves, that was really heartbreaking to witness, because I'm like, we rely on them so much, if not now, like more now than ever. Why don't they have these things? It just doesn't make sense to me. And I remember my mom talking about it as well. And that's how, people started making their own masks. And that's how that started, because we were so afraid of, well, if we can't buy them, we might as well create them.
Right. Yeah, absolutely. One of my colleagues who's a physician was talking about how she would keep paper bags, and she would use her mask for like 4 days or a week, and put it in this paper bag and then use the next one and cycle it out, because they couldn't throw it away. They didn't have any more. So she had to and then wait 2 weeks and then come back and use the same mask again and then use another one in the meantime. Like she would just cycle these out, which was really scary when you think about of all the people who need it,
Right. Because you're almost thinking well, do we even know of what cleaning methods even work for those? Is steam cleaning it even enough anymore? There's so many. I think that's what caused so much anxiety for sure, is we don't have enough answers. We don't have enough information to even know what we're dealing with here. So it's true that, now that a year has passed, we just want to make sure that they know that we haven't forgotten them. We still very much want to keep giving them as much as we can so that they can keep doing their job and getting through this as a whole. So yes, I'm just, like I said, I'm just such a fan of your work. And if you have any need for a volunteer, sign me up. I would love to, because I actually I was an American Red Cross volunteer for years. And then I tried to get active again, during Thanksgiving, if they have a turkey drive or anything like that. But because of COVID, they weren't doing any, events. I'm just letting you know, I would love to volunteer if you guys ever need anything.
Thank you so much. Absolutely. We'll definitely keep that. I mean, I think this is so helpful, just getting the word out. Every time we do any one of these interviews, we hear from other nurses and other hospitals saying, hey, can we get it in our hospital? So it helps us get the word out to donate, but also hopefully it helps people donate to us, because we are entirely donation-based and volunteer run. We're a nonprofit organization. So in order to be able to, we're not charging hospitals for these things, but tablets can get expensive. And in order to be able to do this, we need funds. So just getting the word out is so helpful. So we really appreciate this. So thank you. But I will keep you in mind. If we have something in Northern California, I'll give you a call.
Absolutely. And I'm definitely going to mention this to my mom to see if they can get it, because I don't think it's at her hospital. So yeah, I'll definitely bring it up to her and see, because I know her team on her floor could definitely use it. And everyone else, of course. So yeah, so thank you so much. I'm super excited to get this out to our listeners and to share the word. So tell our listeners again on where they can find you online and where they can donate, all things.
Sure. Yeah. So the website for the initiative is www.caring4ourcaregivers.org. And that's caregivers with an S.org. That has on that first page, you'll see a list of all the hospitals we're in. The Show the Love event is on there still. You can kind of watch some of those videos. We've got links to, it tells you about when we have Wellness Live and that course that I was telling you about, the on-demand course, Coping with the COVID Crisis. So there's links for all of those on there. Our social media page where you can follow us and learn about everything that we're doing is Sufi Psychology is on social or on Instagram. It's at Sufi Psychology. That's SUFI Psychology. On Facebook, I believe it's Sufi Psychology Association. And that other organization that I was telling you about that does the meditation, since they have free sessions, is www.tamarkozapp.com. Now, Tamarkoz is spelled Tamarkoz. That's the name of the practice, tamarkozapp.com. And it's the same name for Instagram and Facebook. So you could just go on and you can see and watch these videos and gain some benefit if people are struggling and they need a moment. This is a way to do it. Like I said, 10 different languages. So if you have an older family member who perhaps only speaks a particular, they don't speak English, this is a way for them to get some meditation, so it's really helpful in that sense. Also, if any of your family members or friends are getting the vaccine, as you know, a lot of people are having a reaction to the second dose of the vaccine, and some people are having difficulties with it. And what happens is it's oftentimes just a waiting process. You have to wait, 24 hours, 48 hours, however long it is, for your body to kind of adjust and go through it. And so the Tamarkoz app has created a free category called Vaccine Relief, where they have visualizations and things that if you're tired and you can't get out of bed and you're waiting for this to take its course, you can just listen to and gain some benefit. So a lot of free resources for people. That Vaccine Relief there's a few exercises on their Instagram page, but if you download the app, it's for free on there. You can just gain some relief. So I would really recommend people who are getting the vaccine, when you get the vaccine or before you get it, just download it and have it ready to go in case you need it. So there's something there.
Well, thank you so much. That's so great, because I know a lot of people that got that second dose, they were just in bed they were documenting their experience, but it's different because they're like stressing out about how they're feeling. And so I think that was a really great point to bring up, that there's tools out there to help you through even that period. So
yeah, you don't want to be in your head. One of the things I found is people are like, is this normal? Is this not normal? And then the anxiety gets going. So having, I think, something specifically for this purpose to kind of get you out and into a peaceful place is a good thing.
Oh, love it all. So thank you all so much for tuning in. Thank you, Dr. Saloumeh. It's been such a pleasure chatting with you today and hearing about all the work you're doing. Huge fan here. And, and yes, so you guys will see all the links in the description box. And if you guys have any questions or concerns, you guys know where to reach us. So thank you so much.
Thank you for having me. Have a good day.
Thank you.